This is Tom Berkley, and today I'm talking about osteoporosis. This is something I see all the time, and statistically, 1 in 3 adults are going to have osteoporosis and a fracture from osteoporosis. Unbelievably common. In the United States, over 35 million people are said to have osteoporosis. It's something that's searched almost 300,000 times per month in the United States on Google. So we're going to be talking about all the new treatments, the best supplements, and the best home treatments. We're going over all the new research studies, and we're starting now. I was contacted by a new supplement called KoACT, and they published some new studies and a white paper. So essentially, they wanted me to take a look at the paper. So that got me thinking, this is something I see a lot about. I don't really dispense the medications, but I deal with it a lot. Osteoporosis, osteoarthritis, joint pain, joint weakness, they're all related. I have a video where I go over the exact cause of what osteoporosis is, how common is it, all the tests, osteoporosis versus osteopenia, all that kind of stuff. If you want to watch that video, check out that link below. But right here, we're going to focus mostly on the new supplements, the specific supplements, and the best home treatments to get your osteoporosis better. In society today, we're eating more processed diets. We're drinking more alcohol. We're not moving as much. We're not standing as much. And you could see as you get to age 30, 40, 50, 60, our bone mass goes over a cliff. It starts to deteriorate. We get weaker. Our bones aren't as strong. This leads to increased arthritis, hip fractures, vertebrae fractures, wrist fractures. And if we don't turn this around, we're going to suffer with it, because once you reach a certain age, you're at risk of all these problems, decreased mobility, and then your health only gets worse. When I think of osteoporosis, I think of it all as strong bones, strong joints, strong ligaments, and good function. And bones are perceived as rigid and lifeless, but the reality is they are living dynamic tissues. Throughout our lives, our bones are constantly remodeling, regenerating. Old bone is resorbing and becoming new bones. There's two types of cells. There's osteoclasts and osteoblasts. What happens is osteoblasts blast out new bones. They build new bones, whereas osteoclasts chew up our bone, weaken it. So if we need calcium and minerals in other parts of our body will cannibalize our bones and send it there. Our hormones in our body, specifically our parathyroid hormones and other hormones that we're going to talk about, can create new bone or weaken new bone. The balance shifts with age. Specifically, as we get older, our bone mass is typically achieved at 18 or 25. Most people watching here are over 25. And at that point, our bone starts a steady decline until it eventually falls off a cliff. And specifically where this is most common is over 65 or menopausal women. Menopausal women specifically have the highest amount of osteoporosis. At that point, they lose about 20% of their bone or more. 25% of postmenopausal women will develop osteoporosis. On the left-hand side is your skeletal mass in grams. You can see the male is about 1,500 at about age 25, 30. The female is on average about 1,200 grams, but you could see age 50, 60, 70, it dramatically declines, especially postmenopausal females over males. This is a huge drop in bone mass. It has to be prevented for a healthy life. 35 plus million people in the United States have it. The hip, the spine, and the wrist are the most common. I see a lot of broken ankles and a lot of stress fractures in the foot as well. 20% of people with hip fractures will pass away within 1 year of the incident, unfortunately. That's a huge danger. It's said that about 1 in 3 to 1 in 5 people will fracture their bones, higher in women than men. And the scary part is, for people who fracture their hip, 1/5 of them will not survive more than a year at that point. The most common drugs, there's a lot of drugs out there. Bisphosphonates are the most common. They impair osteoclasts, so they prevent the breakdown of bone rather than stimulating the buildup of bone. Some studies show that this can be negative because it throws off the natural balance of osteoblast versus osteoclast activity in the bone. Historically, there are vitamins, diet, and supplements. So vitamin D, magnesium, vitamin K2, calcium, those four. I go over these specifically in all videos. all very important. Vitamin D, very, very important. I have a ton of videos about that. Huge mistakes, about 78% deficiency around the world. If you look at the composition of bone, about 2/3 of it is ceramic material like calcium and potassium, but the rest is made of organic compounds, mostly collagen. So now what's collagen? Collagen, when you start shrinking down, at first you see the hard bone, but then you see the cells that make up the bone, and then you get down to collagen fibers. These collagen fibers are made up of tropocollagen, and this is the base element that adds the flexibility and the scaffold. This has to be nourished as well to avoid osteoporosis. What we're going to talk about with the new research is the 25% of the bone framework that is collagen. Here's where the new studies come in. Bone is made up of collagen, about 25%, and a mineral matrix consisting of calcium phosphate, magnesium, and a few other minerals. That makes up about 75%. And we have those living cells such as fibroblasts, osteoblasts, and osteoclasts. I think about it kind of like a scaffold. The collagen creates a scaffold and the minerals develop in between. The collagen adds that flexible, wavy part of our bone, so our bones do have some bend, whereas the calcium and the minerals add that rigid cement-like quality. The bones are living and they regenerate and break down all the time. Traditionally, we're going to talk about supplements towards the end of this video. All of the supplements focus on the calcium phosphate, the calcium matrix, so the hard, rigid, concrete-like bone. When we talk about vitamin D, calcium, magnesium, when we talk about those things, they focus on that hard cement-like quality. Historically, there haven't been really any supplements that focus on the collagen. Most of them focus on getting calcium, getting potassium in the bone, but you could see a large portion of it is the collagen, which has been neglected. KoACT, I did get some studies sent to me. These are some newer studies. This is a newer compound. I've not heard much about it. You can't Google a lot. So this is a pretty early look. This is said to be one of the first supplements that addresses the collagen matrix. And the studies look pretty good, even though they're not huge in number. The study as I was sent and the samples is for KoACT. This is a patented chelated compound of calcium and hydrolyzed collagen peptides. This was initially patented in a Tokyo university in an animal study. KoACT results were significantly better than regular calcium alone, or even calcium and just regular collagen supplements. This is basically a complex of collagen and calcium that is better used by our body. So study number one is an animal study by the Tokyo University of Technology. So this study checked KoACT's effects on bone and mineral density using a well-known rat model. KoACT is a collagen product that models natural bone structure. The study looked at 26 animals, so not a huge amount, and it broke them up into 4 groups for 8 weeks. The first one got no supplement. The second one got KoACT, and this increased bone density after 8 weeks by 3.5%. The third one got 10 times the KoACT, which increased the bone strength 10% roughly, whereas the fourth group got calcium supplementation and collagen supplementation in an equal amount to the KoACT, but not the same structure, and it went up by maybe 1% or so. KoACT focuses on providing nutrition to the collagen, and essentially in that mouse study, which admittedly was a small study, it did provide about 10 times the benefit that not providing collagen did. The KoACT did a lot better than them. Now, is this a huge study? It's not a huge study, but it is promising results. I think the data could definitely be higher level, but that's true of any supplement and study. A second study was performed by the Florida State University, and this looked at 52 postmenopausal females. And this was a blinded and randomized study. 52, it's a decent number. It's not a huge number. You always look for bigger numbers. They basically blinded and randomized 2 groups. One took calcium and one took the calcium collagen peptide combo called KoACT. They checked at 4 time intervals. Initially at 3 months, at 6 months, and at 1 year. And they looked at 5 bone markers. The bone markers, osteoblasts, when they build bone, that can be high, and osteoclasts break it down. So if you're building bone, you want a little bit less osteoclast activity. And KoACT essentially looked at these markers. So with KoACT, the osteoblast activity was higher and the osteoblast activity was lower. So we can conclude that essentially it did stimulate some bone growth. These are very promising. It is a mouse model. It's a smaller human human study. It definitely needs more publications. And one important application in upcoming research is that KoACT can prevent cancer patients at the end of 12 months from losing bone mass like they normally would. I kind of noticed there's 5 or 6 people already selling this supplement. The reviews are pretty good. The price is not that bad. What I do in these cases, you can test it out. You can see how it goes. This is one that might be worth trying. Some of the reviews are pretty good. Realistically, they do need more studies, and I think that's probably coming. Magnesium. Unbelievably important in 600 enzymes. Over 60% plus of magnesium is deficient as well. Deficiency rates are said to be between 60 and 90%. So not only are we vitamin D deficient, but we're now magnesium deficient. And you need both of these for it to work. Magnesium works on calcium and vitamin D in these ways. Number one, magnesium is important to calcium homeostasis in the parathyroid gland. So the parathyroid gland releases hormones that essentially tell your calcium to go low or high. That's the parathyroid hormone. And magnesium deficiency can disrupt this balance and affect bone health potentially. Magnesium is also involved in the activation of vitamin D in the body. Specifically, magnesium-dependent enzymes are necessary to convert vitamin D from its inactive form to its active form and is required for various physiological processes. Magnesium is needed for over 600 enzymes in the body. Many of them have to do with vitamin D. Inadequate magnesium can potentially impair the conversion process, lowering your vitamin D even more. And here's where they work cooperatively. Vitamin D and magnesium are both essential for bone health. It helps with bone mineralization. A balance between these nutrients is essential for optimum bone density and preventing osteoporosis. And vitamin K2. This is unbelievably important. Whereas vitamin D puts calcium in your blood, vitamin K2 takes that calcium and puts it into your bone. So very important. This is one where there's no real government regulations, but it's found in our food. Vitamin K is different than potassium, which is actually an electrolyte that you can get in your drinks. K2, K1, and K3 are all vitamins. K2 is different than the electrolyte potassium, which you might get in your Gatorade type drink. There's 3 different types of vitamin K. K1 is phyloquinone, vitamin K2 is menaquinone, and then vitamin K3, not really important, but I list it here. I promise we'll give you a simple guide at the end, but you want K2 to come in the MK7 formulation in your supplements. But the beauty is that vitamin D and K2 can come packaged. You don't have to go crazy and buy a million different supplements. We're going to give you a simple, easy plan that I follow myself at the end. Benefits of vitamin K2, bone health. Vitamin K2 is essential for the activation of something called osteocalcin, a protein that binds calcium to bones. This is critical for bone density and preventing osteoporosis. Essentially, vitamin D puts calcium into your bloodstream, and vitamin K2 takes that calcium and puts it into your bone and organizes it in your bone. It's important for your cardiovascular health to prevent arterial calcification. So it takes that calcium out of your arteries and focuses it into that bone where it should be. And there's a lot of great studies how vitamin K2 lowers calcification. Calcification of arteries is a very big problem these days. It is one of the major causes of arterial stiffening. Take a look at this CT angiogram. This is someone with calcified, and that means bone in your arteries. It stiffens them so they're not flexible. It decreases the blood flow. You get cold toes or blood flow. As a foot and ankle specialist, I check the posterior tibial artery pulse, the anterior tibial artery pulse. This sets a good guideline. If those feel great, then you don't have to do much more. And the way you feel it is bounding pulses up and down. And we also check the capillary refill time. That means when you squeeze the toe, does it refill instantly? If it doesn't, if it's more than 3 seconds, we can use a computer to perform a test. We could perform what's called an ankle brachial index. So that's basically comparing your arms to your feet. Are there potential blockages somewhere? And if there are blockages, so for example, if one ankle is much worse flow than the other or compared to your arms, then we might want to do more testing. You can check the toes and then you can order imaging. You can get what's called a CT angiogram. But what I do is I work with a vascular surgery team. So I work with great vascular surgeons. Essentially right away, they can do a test which is an angiogram where they can release dye. They can essentially check if anything's narrowed or blocked, and then you can correct it. So this is one of the images where you could see, is there cholesterol built up? Is there a plaque? Is there calcification? But one of the things that can really help with this is vitamin K2. You want to get that calcium into your bone. So studies show vitamin K2 is very beneficial with patients with aortic valve calcification, and a couple other studies too, combined with vitamin D. Now, it won't reverse your arteriosclerosis and make you like a baby again, but it can prevent it from getting worse. And especially the earlier you start, the more benefit it can have. Studies are coming out every day showing how important vitamin K2 is in taking that calcium and putting it into our bone. So very important. I highly recommend checking out those videos. The World Health Organization, FAO, say that people probably only get 5 to 25% of their daily recommended value of vitamin K2. There's two types, MK4 and MK7. MK7 lasts a lot longer, and it's found in fermented foods, natto, soy, sauerkraut, cheese. It is also made by GI tract fermentation. And calcium supplementation. There's some breakthrough studies on calcium as well. Highly recommend it before you go out buying just regular calcium supplements. Watch the new studies, because there's huge changes that have completely changed the recommendations for calcium. This is such an exciting topic, calcium. I have a whole video about calcium, what the big dangers, what the big mistakes are of taking too much calcium. There's really bad forms of calcium and there's really good ones. But essentially, studies now show taking too much calcium, more than like 1 gram or 1.5 grams, it builds up in your arteries, in your heart potentially. So you don't want to go crazy with just calcium supplements and being vitamin D deficient. That's a huge secret. Vitamin D is really what regulates use of your calcium. So drinking a glass of milk, eating some cheese, or eating vitamins, or potentially even just eating vegetables if you're a vegan or vegetarian, probably can get you enough calcium if your vitamin D is adequate. So most people don't need to take a calcium supplement. Really, even women post-menopause, the people who really need it because osteoporosis is higher, maybe if you're malnourished, maybe if you're a vegan, but otherwise, make sure you're getting enough vitamin D3, because really, vitamin D takes up the calcium from your gut, and K2 helps put it into your bone. So between those two, you're going to get a lot more effect than just taking calcium. If it were me, focus more on the vitamin K2, the vitamin D3, and even the magnesium. I got to get the magnesium to pop up here. What an exciting topic. If you have any osteoporosis or bone problems, check out all my osteoporosis guides below. Calcium deficiencies can be anxiety, depression, brittle hair, brittle nails, stomach pain, increased urination, dry skin, tingling feet, cramps, but calcium is controlled by something called your parathyroid gland. This creates parathyroid hormone. More parathyroid hormone creates more calcium in your blood. Less parathyroid hormone creates less calcium in your blood. Parathyroid hormone also controls vitamin D production in your body, and both together reabsorb more calcium in your intestine, and together both can function in putting that calcium level to its proper normal level. All these minerals address the 75% of the bone, that's the minerals. If you have osteoporosis, here is what you want to do in order. And I go over this in my home remedy guide. Number one, the single most important thing is you have to strength train. If I had to assign a most important value to any single treatment, number one is strength train. Work your muscles. Go for walks, strength train. If you are older, even 60, 70, 80, 90, we have a strength training guide that's safe for older people. But number one, before you start strength training, get a biomechanical exam. If you have a slipped disc or if you have a dislocated hip or something, don't start doing strength training. Get evaluated by your doctor. That's something I do all the time. And seeing a physical therapist, seeing a podiatrist, seeing a specialist, your primary care doctor, get evaluated and start moving, because with osteoporosis, you don't want to break a hip or an ankle. Even doing basic stuff, lifting a book in front of you, doing wall push-ups, pulling yourself forward in a doorway, doing air squats, just like this, going for walks. The more you move, that's Wolff's law. And Wolff's Law means if there's stress applied to bone, that bone will strengthen. That's the single most important thing you can do. Your ligaments, your bones, your joints, everything will get better. Wolff's Law states whenever there's more pressure, more compressive force, that bone will develop more strength, more trabeculae, more fibrils to strengthen itself against that force. So the more stress and the more strength training you do, the stronger your bones will be. If I could recommend one thing, get physical therapy, get into some type of strength training class, Pilates, strength training, going to the gym, anything. It's all a great start. I give some links on that below, but start that. Number 2, cardio. The single easiest thing you can do is start a walking program for cardio. Get the right shoes, get the right insoles, start moving. That's the single most important thing. I have a guide on how to start a walking program. We link that down below. Number 3, sleeping. This is more important than diet and supplements, but making sure you get enough sleep. 35% of people are not getting enough sleep. So your hormones are low, you're not healing your muscles. Getting enough sleep can help. I have sleep guides, best sleep positions, best sleep supplements if you're having a hard time sleeping, how to fall asleep fast without any supplements. That's probably the most important one. Check out those videos below. And then you have diet. So obviously losing weight helps. Those other things are more important. And then you have supplements. I have video guides on vitamin D, magnesium, vitamin K2, all the big mistakes with all these omega-3 fatty acids, everything you'll need for strong bone health. Check those down below. If I missed anything, let me know. And also check out our full osteoporosis guides, the best medications, the best home remedies, the best treatments. We rank them in a countdown and we're starting down there. Click on it.